Mr. Kurtz, you've had some pretty significant visual loss there in your right eye, and we're concerned that this may be due to inflammation. We did some blood tests, C-reactive protein and an erythrocyte sedimentation rate, and they were elevated. These are signs of inflammation in the body. They're called acute phase reactants. When we see this constellation of visual loss and pain that you have around your eye and in your temple, with elevated blood markers like you have, then we get concerned that your visual loss is secondary to inflammation. The type of inflammation that would be most serious is due to something called arteritis, giant cell arteritis or temporal arteritis. It affects all medium-sized blood vessels, such as those that go to the back of your eye, throughout your body. And so what we do when we suspect this, because it's such a devastating thing that can cause strokes and kidney failure and other problems, is to get a biopsy of a small, medium-sized blood vessel. And we can do that because these blood vessels are found right here in the temple. We can take a small piece of one and have a pathologist look at it and look for signs of type of inflammation that can be devastating to you. And it's a really relatively simple thing to do. There's very low complication rate with this. You may have a little bit of a scar, but that's really about it. It'll take us about 15 minutes to do. We'll have a bandage over the area. You'll take off the next day. We'll check you the next day, and we'll have an answer for you in 3 to 5 days about what to do. There's some stitches that need to come out in about 5 days. And in the meantime, we'll be putting you on some medicine for inflammation, some prednisone. And in your case, we'd also give you something for your stomach, some Zantac, 150 milligrams twice a day. Do you have any questions about this?
How did this happen? Is this genetics, or is this something that I've done? Or
it's an immunologic problem. It's not related really to genetics. It's not related to anything that you've done. Sometimes the immune system goes out of whack.
How soon do I need to take care of this?
This is something we need to do relatively soon. We want to start you on the medicine today. We need to get the biopsy sometime in the next 2 weeks.
As a medication, you said it could upset my stomach?
Prednisone and other steroids have a tendency to cause gastritis, and so we put you on an H2 blocker like Zantac.
And could I go to work afterwards?
You can go to work the next day.
Next day, okay. So let's go ahead and schedule this.
Do you have any other questions?
There's so many, but I can't think of any right now. I'm kind of trying to
Well,
take care
you
of
can
this.
always get in touch with us. You can give us a call, or you can send us an email, and we'll be happy to answer any other questions that you have. I'm going to let you talk to our surgery coordinator, see if she can get everything ready for you.
Awesome. Thank you, doctor.
You come right here with me, and I'll take you over to her office.